Today, we're going to be learning about DLBCL treatment goals and how patients can be active members of their team. So let's start by understanding who is typically on a patient's DLBCL healthcare team.
It's a good question. The members of the DLBCL healthcare team usually consist of a physician, and this person usually would start the process of saying, this is something I don't know what's going on with this mass or this pain you're having. Let's get some imaging. Let's get a biopsy to figure out what's going on. There'd often be a nurse as a member of the team, and the nurse usually provides a critical service in terms of help facilitating patients to understand what's going on and to work with the healthcare team directly to provide excellent patient care. And eventually there would often be a pharmacist involved in terms of the chemotherapy or treatments that are administered to help review those and work with the physician and the nurse directly. Those would be the main members of the healthcare team. Occasionally there might be a social worker or there might be other care providers that are involved, but usually it's the physician, the nurse, and then sometimes a physician extender, such as a PA or a nurse practitioner.
Okay. What do you feel is the patient's role as a team member?
Patients are a critical part of our team and are often the decider of what goes on. The physicians, nurses, PAs, pharmacists, our jobs are to help educate the patient and to help the patient to decide what the best treatment is. Ultimately, it's the patient's responsibility to understand what's going on, to ask good questions, and then to make a decision about what treatments are best for them.
Mm-hmm. What role do caregivers take?
Caregivers often play a very important role, and it's variable from person to person how involved a caregiver is. But if patients have symptoms or side effects of treatment, caregivers are often critical to make sure patients get the appropriate medical care that they need. Some treatments may have more potential for side effects than others, and sometimes caregivers are essential to actually stay with a patient even during an admission to the hospital to make sure that patients are monitored closely. And we may talk about different treatments today during the interview, but at our center, sometimes we even mandate that the caregiver is involved in the sense of staying with the patient in the hospital for certain therapy types. But in general, being a supportive family member or caregiver, it's a good thing to have, even if we don't have a lot of toxicities for emotional and physical support. But sometimes it's really important to help manage toxicities.